to give you some insights about what is the situation in Kashmir. So before that, I would begin with the topic of equity. I mean, what do we mean by equity? Can anyone tell me? Can anyone? What is equity? What is the difference between equality and equity? Why we have equality and equity? What's the difference between two? Why can't we just have equality? Why can't everyone be equal? Can anyone reflect on this? Adrita, you. So, equality means when everyone is equal. My height is equal to you. Right? My weight is equal. I'm giving a very normal example, non-scientific. Equity means if my height is short, I give myself more nutrition so that I become as longer as yours. Understand? So it's need-based system. That's equity. So beginning to Kashmir, Kashmir is suffering from inequality also and inequity also. Both. No one is equal there and no one has success in equity. So basically this is a secondary data situational analysis. It's kind of a systematic review. There is not much data available on Kashmir because it's a conflict zone and different political partners, key partners are not really investing in that. And second part, it is involved with a lower middle income country. And when you know when someone becomes a lower middle income country, the funds are decreased. But that part of the country is very underdeveloped. It's lower, it can be said as a lowest income country. So this is a ecological fallacy we see here. Because that is the lowest, but it falls under a big high income country, lower middle income country. That's why the access to healthcare is very poor. So I would like to begin my presentation by calling it evidence speaks louder than tongues. Someone told me that you should put a than there. But I speak, tongue itself speaks a lot. But evidence speaks louder than your tongue. If you have evidence, you don't need a tongue. Health. You know, health is a misunderstood term. People say that physical, social, mental, now they included mental, psychological also, but I don't believe that. Health starts from your age. What is your sex? And the other constitutional factors, the environment around you, the individual lifestyle. Do you smoke or not? How do you talk to people? How do you behave? The way you walk, the way you dress up. This all constitutes in health. It's not only physical health, social health, mental health, no. These three are the broader themes, but the themes have to be decentralized down to the ground. How do we start? And this is how we start. This thing means that physical, social and mental. This is the framework. That means age, sex, social community. The idea was to give you that health is never only physical health. I have diabetes, I am sick, my health is low, no. Health is like a score. We are researchers here. We develop scoring system, right? Scoring system. Health is like a score. A person can have higher score, a person can have lower score. Moving ahead. So, in the framework of health that we just saw, this one, the most important missing factor is this. This is the most neglected determinant. You know why? Because it is mental health. And mental health has the most and the biggest stigma around the world. Do you know what is the definition of PAGOL? P-A-G-O-L, PAGOL. Can anyone tell me what is PAGOL? No one can tell me. Because for you it has one definition, for him he has another definition, for you you have another definition. We don't know what is mental health. Mental health, according to the Cornell University, which is one of the profound universities for mental health, they say that these providing mental and medical services, counseling. If someone is not feeling happy, he can go to the counselor and talk to him. Identify people in need of care. I am focusing on this point because I will be using them. I want you to be very attentive here. I will be using all of this while explaining the situation in Kashmir. Increase help-seeking behavior. What is help-seeking behavior? Today we are in this institute. Tomorrow, for example, I get a project and I need a collaboration. So my help-seeking behavior, I'll pick up a phone and call Professor Azhar. Sir, can we collaborate? I need to do a situation on a sloping review or a desk review. Right? Promote social connectedness and resilience. Can anyone tell me what is resilience? Do you guys know what is resilience? Do you know, yesterday there was an attack or a disaster or whatever, a crisis situation in Banani. We were not ready there. You know, we had to go there. If we were ready there, that is called resilience. And health system is supposed to be resilient. Then foster a healthy education environment. We all know we don't have a healthy education environment. Our benches are like this, we get in there and we come back at 5 and we're sitting back pain, neck pain, spondylitis. See dentists, medical persons, surgeons, everywhere, we don't focus on these things. Restrict to the access of means of suicide. 67% of the people say that they want to commit suicide in Kashmir. 67% of the persons say that they want to commit suicide. Deliver coordinated crisis management. Crisis management has a whole new framework. Professors from Dhaka University, there's one professor, I forgot the name, I'm sorry. He's also the chairman of syndicate board. He's the, and I think Professor Khairul Islam, Professor Ateeb Rahman. They are working in climate change and they can tell you what is crisis management. The management of crisis in mental health or in overall health, it is a totally different phenomenon. How we can manage a crisis? It starts by identifying who are the people which are vulnerable to crisis. If you go to the Khulna region, you will see people have hypertension more. Why? Because salinity, right? So crisis management, resilience, this all is health. What I am trying to explain, it's a coordinated framework. It's not like you are a doctor, I am a dentist, she is someone, she is someone. No. Health sector is not like that. It's very complex, very vast, and we call it a complex problem. Next one. What is the situation in Kashmir? If you see this picture, it's an observant picture. It's for the observers. Is there healthcare in this picture? I'm asking this question. Is there healthcare? The typical definition of health. Do we have healthcare in this picture? I see we have. He's writing a prescription. He is bandaged. Everything is there. What is missing?
Where is the first aid box?
First aid box, like logistics you are saying, but a bigger picture, go into the bigger, maybe they are lower income country, maybe lower income country again. Missing is, look at his head, there is no counseling.
No emotional support.
No emotional support. A person just lost someone, he lost his hand or something. The same thing is the situation in Kashmir. People see people are healthy as me, but emotionally down. Emotionally down and hollow, no one is approaching to them that what is your needs. And this mental health is influencing people in different ways. I'll be able to prove you. See, this is the data of MSF. We all know MSF is a very nice INGO. They call them Doctors Without Borders now. So 2006 they conducted a study in which they said people who witnessed an event, since this is a non-political gathering, I don't want to say what event is, so I just named it event. Desirable, undesirable, it's an undesirable event. Wounded people, this many people saw. More than 5 times, less than 5 times. Look at the statistics. I don't need to interpret them, we are all researchers here. I don't need to, do I need to interpret them? How many percent? 60% of the people have seen wounded people, and out of them, 20% have seen less than 5 times and more than 20% have seen greater than 5 times. No, you guys can interpret that. The fact is, see the figures. Let's move to the next one.
Excuse me?
Yeah, sure.
About the killings?
Yeah.
So what does it mean actually?
Killings means when they witness someone being killed.
Okay.
When they witness someone was killed in front of them, maybe in a bomb blast, or maybe on a gunpoint range, or maybe abduction and then killed, or maybe in a fire or something. Killings. Trauma.
So witness of killings.
Witness of killings.
Okay, so
it's all. Yeah.
I understood that it might be how many?
No. It's just people, percentage of people who witnessed an event.
Okay.
And these are events.
Okay.
Okay? Yeah. Keep on asking. You can interpret.
What actually means a mistreatment?
Mistreatment. Which one? This mistreatment and molestations. Okay. We are trying to use a polite word, you know. Kashmir is a very conservative community. So, let's see the effects of. Now, this is violence.
I have to just get back to the.
Yeah.
The things that hearing about the rape, I understand your point that it is really very tough to see the witness of rape always, but in case of the incident, what is reported that by Human Rights Watch and other international amnesty, that these are the reported case of the rape.
Self-reported.
Okay.
Self-reported. Self-reported cases.
But this is always under registry.
Yeah. Self-reported, we call
Okay.
it.
How,
Because
what,
there is one
percent,
other-
what would be the percentage that self-reporting?
We will get to that. We will inshallah get to that. Thank you. So let's see the effects of violence. This was done on 1700 individuals. How many people feel afraid? Problems in studying, absenteeism, isolation, drugs more frequently, lack of respect and all. This is a general picture which happens there. See, do you know the population? The population is more than 10 million. 10 million. And let us see what's going on there. On 1700,
One-fourth population are always being affected, right?
are always being affected. And this is the data of 2006. I want to show the trends. In that time, 24%, I don't know what the population was, and 24% that time may probably be 56% right now,
Right.
or maybe 47%. Let's see. So, what is the support mechanism? Where does a person go when he feels not well? First friend, then family member. But why I have encircled this? Do you know what is the 2017 data? Do you know what is the problem going in friends? Maybe you have a good friend, but sometimes this happens. Right? Doesn't it? We call it, what is the first cause of smoking? Peer pressure, right? Peer pressure. So, friend, peer pressure. I'm a scientist, I'm telling you the facts. There isn't a hypothesis in it, but isn't it the best hypothesis available? Sorry. Isn't it? So, look at the statistics. Among the cannabis users and non, that's not my point to prove that cannabis people have more, and that's not the part of my point here is that they seek cannabis for this. And the anxiety and depression among them is high. Now let us go to the new study which involved larger sample size, and they did a post hoc test also after that. What did that reveal? 47% now. The same depression among adult population. MSF report published in Google Scholar, BMJ Open, anywhere you can access it right now. It took them 10 years to get the permission to do this survey. And I'm using these 3 surveys they took to do this systematically. Let's go next. Do you know empty mind is a frustrated mind? People claim that the employment in Kashmir is, this is according to Kashmir Mental Health Survey, the government survey. Government did this survey. Some employment, family business, student, unemployment. What is some employment? I don't understand. What is some employment? Either it is formal employment or it's informal employment, right? We know, researchers know. So what is some employment? Let's look at these colors only, because this is the total one. Huh? Let's not get confused. Look at the home duties. Look at the unemployed and retired people. And what are these populations? Now what I say, I hypothesize is that these are 2 populations. One who have some sort of employment, means they are either student or they are working in informal sector or they are busy, and another are those people who are completely retired, and those people have duties. And look at that, women definitely, God forbid, women have to be daily chores and all, everything. That is what the social norms and everything is. That is something we are fighting for, right? Even United Nations is saying invest in women in science. But what I am trying to say is try to understand these are 2 populations. One population is completely doing nothing, and other population is doing something. And this is a huge impact. So, what are the physical complaints these? Moving on to the other paradigm of the framework of health, what are the physical complaints these people face? Body aches, body pains, mental, heart, internal, chest, others, these are episodes. N is 510. This is according to priority. According to priority. See? Mental, body pains. I don't know the reasons. I don't know why. Headaches. I don't know why. All I'm saying is I'm telling you the data. This is what the data speaks. And 2015. Now what? Do we all agree that there is an outbreak of mental health crisis in Kashmir? Do we agree? Do we all agree that there is an outbreak of mental health crisis? Like there was an outbreak of Ebola, there was an outbreak of Nipah, there was an outbreak of cholera. There was outbreak of lot of things. In Bangladesh, there has been outbreak of cholera, and they established Matlab Surveillance Center for that. But do we all agree that there is an outbreak of mental health crisis in Kashmir? 47% people are suffering. 47%. What else do we need to do? Let's do an outbreak investigation. Let's do. Do you allow me to do an outbreak investigation here right now using secondary data? We will do it, inshallah. What are the steps? First, we identify. So, we are the team and we are the resources. Number one, gone. Establish existence of them. From past 15 minutes, I am establishing the existence of an outbreak, right? Third one is verify. Now, we will verify whether it is there. So, first one is done. Second one is done. Let's go third. Let's see what the stats say. 1.8 million, 45% of the adults in Kashmir have mental distress. KMHS 2015 BMJ Open MSF. Both continue. Approximately 415,000 meet the diagnostic criteria for severe depression. That was the answer for your question, sir. Not self-reported only. They meet the diagnostic criteria. Moving next, an estimated breadwinners who have to go out and earn. 26% of them anxiety-related disorders. 1 in 5 adults, PTSD, post-traumatic stress. That means, if we, do you know what is the average household of Bangladesh? Number 4.5. Average household. So, assuming in Kashmir it is same, that means in every family one person, right? Every family one person suffers from PTSD. What are we doing? So, let's move on to the next step. Yeah, sure, please.
I didn't see the earlier slides, but I want to know what you said there. Young breadwinners.
Yeah.
So, they didn't set any criteria of age. As for example, the world standard says about 18 years of age as a
18 to 65.
Yeah. So the limit is between
18 to 65. It's WHO. Now 18 to 65 is young, 65 to 80 is senior citizen, and 80 above is oldest of the old.
Okay.
That is the latest one. So let's go next one. So what is the next? We did these things, verified also. We are all on the same page, right? Let's construct a case definition. Because we don't know what is mental health crisis. Now we will here make a case definition. Just for our practical purpose here. What would be the, if we are going to Kashmir and identifying these cases, how will we identify them? It's very difficult, right? So we need a case definition. So we will see the symptoms that are the most. See what kind of. Aggression, irritability, general behavior change, facial expression, mood, withdrawal, attitude, health problem. I did not focus on these more because then it will become 2-hour presentation. There is a beautiful framework to check how a person is aggressive, how to judge whether a person is aggressive. There are quantitative and qualitative tools, it's very easy to know. All I want you to know is that these 5 for now we are keeping as a case definition. Okay, this is our case definition of a mental health crisis outbreak in Kashmir. Aggression, irritable. So I say if a person has aggression, general health behavior, change in facial expressions and mood, withdrawal attitude and any health problem, I'll call him potential mental health crisis sufferer. Okay, because it's an outbreak investigation. I don't know what I am dealing with. Then this is done. Now find cases systematically and develop line listing. Is that for me to do? The government has done it themselves. They have identified according to age, 18 to 34, 35 to 54, 55 plus. See sir, only adults. They left the old ones. That means the problem itself is in adults and male and female separate. So don't we have the cases? We have already the cases. I just don't have their individual data because I am doing secondary data analysis. But if you give me the power to go, I will identify them individually with a big team. But what I am trying to prove that we have the data. And the data says that it exists. Systematic line listing. We have the data how many people are suffering from what? Depression 69%, anxiety 49%, no distress. Look at this 29%. You have the data. So you have proved that there is a mental health outbreak. We did it. So now perform descriptive epidemiology. Now we all know that we have a descriptive where proportion and frequency are taken as key analytical outputs. That is called descriptive epidemiology. We will not use any data or anything. Simple axis we will say, ato te ato. Out of 100%, 40%. Out of 60, out of half. Okay? It's like that. Descriptive. Look at that. It's already done. 2017. So, what is my hypothesis here? I will choose the big ones. Right? Do I have to interpret it? Should I? Natural disasters, 84% experienced and 10% witnessed. So it becomes my first hypothesis. It's all because of natural disaster. I'm not a biased person. I'm not going to go pin it on government. And second one, no, everyone thinks that it's all about government. It's not about. We are interested in development and we don't care which country it lives with. Oh, I care whether my people are healthy or not. Second, 24%. What? Militant or military attacks. See? We are not biased. We are just saying against violence. Then, 41% have witnessed sudden death of someone unknown, which was parallel with the earlier slide you saw. So what are our, we can't give a big hypothesis because then the hypothesis testing will take 5 years. Only 5. Natural disaster, conflict, violence, shutdown, attacks. Simple. This is my hypothesis. This is the reason for mental health outbreak in Kashmir. We did this. Now what is the next step? Evaluate this. Now go and check how many have right now.
Can you go to the...
Yeah, sure.
Just to know, bad sexual experience, are you talking about
Sexual assault.
assault as well as bad sexual experience? How do you distinguish?
Sexual assault has many definitions. Battery falls in it, assault
Yes.
itself, unappropriate touch. So these are all implemented.
About bad sexual experience.
Bad sexual experience is basically intimate partner violence.
And this will be the mental time.
Yeah. It's like when you ask a woman, it's very difficult to translate this when you are interviewing her. You know, so it's very difficult to tell.
Yes.
You know,
And
so we put them in, categorize them in themes like this. You know, I'll give you a small example. We were doing this thing on, can I sit? I'm sorry.
Please.
You know, we were doing this, our stakeholders were doing this analysis on LGBTQ community.
yes,
We were doing, and suddenly in Thailand we saw they did a big protest. You know why? Because we were calling them IUD, injectable drug users, IDU. They said, no, this is a stigma. You are naming us, this is entitlement. Do you know what we call them now? PWID, people who inject drugs. So this is just language and nothing else. The thing is same. What you are thinking, it's same. It's just that we change the language to make it more polite, and I don't want any problems from anyone. It's very smart move. Next one. So we have all of this. Now we need an evaluation. We need implement control measures, communicate findings, maintain. Do we have the power to do that here? Can we communicate findings? Can we implement control measures from here, me, here, you, us? That's why it is a way forward. It is a way forward. It's a recommendation. Someone has to complete it. If I did an outbreak investigation, 60% I will consider it. Someone has to go, take forward, get funds and do the rest of the 40%. I showed you very easily that how easily it can be done. It's just that a person has to take an initiative, frame a framework, get a collaboration, go get in the field and go do it.
So,
Wonders will happen. Yeah.
So you did the easiest part and you leave the hardest part for the
For them, because it's not in my power. If you give me the funds, I'll do the hardest part and come next year to show you the rest.
With the sweet.
It's not one person. I'm not influential person. What to do? I cannot implement control measures. First of all,
Yes.
I need J&K government to be on my side, right?
So did the best within his limits.
I did best what was in my limit using data and evidence. That's why I said evidence speaks louder tongues. It's not my data. It's just what the data, it has been there from 2006, but no one saw it. Anyway, so what is the conclusion? I conclude this with that mental health remains the most neglected area. And when I say most, I mean most neglected. Most neglected. We say menstruation, pads of menstruation, whether they will dry it in outside, these are all fine. Mental health includes these also. So this is the most, don't neglect mental health only to someone power, no. A person not able to speak to his father about masturbation is mental. A person, a child, when a baby girl, 11-year-old, when she has her first period, she's not able to tell her mother or father, that is mental. When a person sees violence, that is mental health. And that is the most neglected area. Even if you go to a Bashandik slum, has anyone ever thought, where do these people dry their cloths, menstrual cloths? They don't have money to buy, I'm telling you because I have worked there. They don't have money to buy sanitary pads. Where do they dry it? Has anyone thought of it? Do you know where the hanger bitore upore ekta kichu thake. Hanger, it's not sterilized. The sunlight will never reach it. So same thing is neglected area. We have neglected it as if it's nothing. It doesn't exist. This mental health. Recently there was this. I'm sorry, I'm taking time. Recently there was, it helped me because I come from Kashmir. I have seen terror there. You know, recently on New Zealand, we saw this person coming with this, and everyone is saying that he's a terrorist. I accept he's a terrorist. But why you say he's not a mental health patient? We all admit he's a terrorist, but why are you stigmatizing just to win your arguments? People are saying no, just because he's not a Muslim, he's a mental health. It has nothing to do with that. Don't include religion and other biases in this. The thing is, first he is a mental health client. He has mental health issues. He did terrorism. Two different things. Don't compare apples with oranges. Yes, sir.
There is a very serious, you can say also interesting matter, because law applies a very test, McDonald test, to understand whether a person is insane or not. Two things are basically meticulously considered by law. Legal philosophy. The first one is that at the time of commission of a particular thing, whether a person can understand the nature. And secondly, the consequence of. So a person may be medically insane or somehow he may be insane, but he may not be insane in the eyes of God. That's a really dramatic thing.
I will call it a paradox.
Yes.
Right? A fallacy. A fallacy. For us, what is literate? You know what is literate for us? A person who can read and write his name. And we say 100% literacy in Kerala. A person, what is education? That's different. What Sir said from the law perspective, that is why when we need legal proxies for someone, right, sir? I'm not a student of law. I wish I was a lawyer. I've always wanted to be a lawyer. But
still you could.
So, inshallah. So, legal proxies. But I'm talking from the field of healthcare, because we have to support these people also. Who will support them? Who will support them, right? Like Sir said that we will declare him insane and we will put him behind the bar.
But there is an interesting thing, I think, that is that in jurisprudence, legal philosophy, there are basically four theories: deterrent theory of punishment, preventive theory of punishment, retributive theory of punishment. But interestingly, law has basically captured the image of this thing, that we formative theory of punishment. Basically, that type of legal philosophy considers first offender, the juvenile, as the patient, mental health.
Thank you so much.
And
this is what the word means.
And I don't know exactly whether you have gone through the literature of Michel Foucault about the madness and civilization. I think if you have time, sometimes you could go to the how civilization depicted mad people, whether the street is right or wrong, because they're treated very inhumanly
and in a fashion as if they are lesser.
Even sometimes the diagnosis of
exactly.
Also
someone is, panic. Some people panic. Oh, to pagal. What is the definition of pagal? We don't have any. So, more than half of the population is suffering from mental distress, which is staggering and really hurtful for a person to say who belongs from that place. Mental Health Act, it came in 2017, but still no progress has been made. It came, but it's still too fast. It's like Bangladesh Rehabilitation Council Act, which came in 2000 something, and still we have not seen it in that. So, by the way, once what happened is regarding the Rehabilitation Council Act, this is an Adda, that's why I'm giving more information.
You can also speak in Bangla.
I want to. I love to speak Bangla. Although my Bangla is not very good, the Tan is Indian. So, you know what? This in Parliament, once what happened is the psychiatrists suddenly got up and they said that why are you giving psychologists our range? Same range of payment, same range of Sheikh I said, sit down. My colleague, my acquaintance, my sibling has autism, and do you know who diagnosed it? A clinical social worker. What have you been doing all these years? Sit down. I will not give you. They are of same grade. Then they made the Bangladesh Rehabilitation Law Act, but I have not still seen it on paper yet. It's still in the documents. Anyways, inshallah, we hope for better things. So the recommendation is immediate installation of mental health satellite centers. We don't need infrastructure. A programmer, better programmer, will install a satellite center in someone's home, so that there is no stigma. People will feel like I'm going to meet Shanta Apu. Okay, I'm going to Shanta Apu's home for mental health advice. So satellite centers. Then mental health awareness must be decentralized to household and school level. You don't need banners out of it. You need to go to household and talk to people about it. Surveillance is necessary. How many people are coming with these comments? Surveillance is simply nothing but repeated cross-sectional surveys. We all know what a cross-sectional survey is, right? It is a repeated cross-sectional survey. Maybe after 1 week or 6 months or 1 month or 1 year, but repeatedly I am taking the data and checking the trends, whether the incidence increased or decreased, right? So, community health workers, this is my favorite one. This is mine one. I call it an AAP. It's my name, Ateeb Ahmad Parray. This one is mine. This is my own one. Community health workers we have here. WHO talks about task shifting. Do you know what is task shifting? I will tell you about this. There are two things. One is, it's okay, I'll help myself out. Okay. So, do you know what is officiating? Officiating and task shifting. These are two different things. Officiating means we are employees. All of us are community health workers. One is absent and I tell, Bhaiya, apni unar yete jaan. Uni aajke ashen nahi, you go and you fill in. That's officiating. And that is my skill. It is manager's skill. It is manager's ability that I made you go and work on her behalf. That's officiating. It happens. What is needed is task shifting. Task shifting means that you not only are a research associate, but you are equipped in other fields also. We are all-rounders. We can do anything. We are trained on different, that's why they say capacity building activities, other activities, so that we can endorse task shifting. That is needed in Kashmir because population is less. Where will you get workforce? You will again get workforce for some country and then they will never leave. So, sorry. So task shifting is necessary. The community workers who are there, those community workers need to be trained. International consultant will come, he will train or he will evaluate the program. He doesn't need to go and do the program himself. The community workers will do it. It's very easy, they just need a training. WHO has developed a beautiful mental health framework. So that's all from me. I would like to acknowledge MSF's 4 papers which I have used. Queries can be mailed to me. I'm always welcome to collaborate, and for these events I'm always happy to welcome and collaborate. Thank you so much. Thank you for having me. Questions are welcome.
Thank you very much. I have 2 just